And you should always know that you're going to be standing in front of everybody and not in a little room with 25 people. So when I walked in at 12:30, I went, I have to go up there? So we're gonna wing this. I've read this a couple times and we're gonna hope that I can get it right. I'm going to introduce the next panel who are speaking on the Federal Interagency Reentry Council, removing barriers for the formerly incarcerated. We have Maureen Beckman, who currently serves as the counsel to the Assistant Attorney General, Office of Justice Programs for the U.S. Department of Justice. Covers a broad spectrum of criminal justice issues, primarily sentencing and corrections. She's held the same position with the Office of Justice Programs during the 8 years of Janet Reno's tenure as Attorney General. Ms. Beckman has served on a variety of other components for the Department of Justice, including the National Institute of Justice, the Criminal and Civil Rights Divisions, the Federal Bureau of Prisons, and the U.S. Parole Commission. Ms. Beckman is a 1985 graduate of the Georgetown University Law Center. She also has a master's degree in counseling and an undergraduate degree in criminal justice from the University of Maryland. As a volunteer, she sits in the local Community Justice Coordinating Council and mentors people re-entering from jail and prison. Ms. Linda Mellgren is a senior social science analyst for the Office of the Assistant Secretary for Planning and Evaluation, Department of Health and Human Services. Her areas of policy and research work include child support, fatherhood, marriage, healthy relationships, and the intersection of human services and criminal justice populations. Currently, she's managing the National Center for Family and Marriage Research, the evaluation of family strengthening grants for incarcerated fathers and their partners, and the health and human service activities related to the Interagency Reentry Council. Linda has an MPA from Maxwell School of Citizenship and Public Affairs at Syracuse University. And finally, Kenneth W. Robertson is the team leader for the Criminal Justice Program's grant portfolio at the Center of Substance Abuse Treatment with the Substance Abuse and within the Substance Abuse and Mental Health Services Administration at the U.S. Department of Health and Human Services. He oversees a team of government project officers who manage the Offender Reentry Program, the Adult Treatment Courts Collaborative, as well as the Adult Juvenile Family Drug Court portfolios. These are discretionary grant programs designed to reduce the gaps in the nation's substance abuse treatment services for the criminal and juvenile justice populations, and to address emerging drug trends at the state and community level. The current budget for these discretionary grant programs is over $67 million. Mr. Robertson is CSAT's lead program officer on numerous interagency criminal justice initiatives, including the interagency workshop supporting the Attorney General's Reentry Council, the NIDA Criminal Justice Drug Abuse Treatment Study, and the Federal Consortium addressing the substance abusing offender, as well as SAMHSA's Bureau of Justice Assistance Drug Court and Offender Reentry efforts. He was a lead programs official on previous SAMHSA BJA initiatives, including the President's Prisoner Reentry Initiative grant program and the Serious and Violent Offender Reentry Initiative. He also served as a CSAT Public Health Advisor with the Criminal Justice Systems Branch from 1993 to 1997, developing criminal justice substance abuse treatment linkage programs and monitoring the grants awarded under these initiatives. Okay, well, I'm the fill-in. And without further ado, we'll turn it over.
I don't think we thought she was going to read the whole thing. Okay, well, a couple of things first. I'm Maureen Beckman. We know we're not at the National Task Conference in Baltimore, Maryland. We just forgot to change the title, so we appreciate being here. Secondly, I want to say that I think our panel is going to, in contrast to the previous speaker who had all these tough decisions for you, it's a little bit dour on the news she was presenting. We have good news. We have a very happy presentation, and I think you'll be quite pleased with what we have to say. I sure hope so. So Linda and I, the first two of us, we're here to talk about the Federal Interagency Reentry Council that Attorney General Eric Holder established, and we are going to share some tools and policy openings that we hope will be helpful to you and your clients when you try and improve reentry outcomes for them. Now, this presentation, we've given it many times, as you can see, we forget to change the title page. We usually start out, in many cases, with the question of why is reentry important? In this case, I don't think we have to tell this audience. I do just want to remind you very briefly that 2 out of every 3 released prisoners will be rearrested for a new offense, and half will be reincarcerated within 3 years. And so when reentry fails, the costs, both societal, economic, and for public safety, are very high. So this group understands why reentry is important. I think the more important question here is, why are so many federal agencies involved? And the answer is that we've come to realize that the federal agencies understand that we're all dealing with the same person. We're just dealing with that person through a different lens. I work at the Justice Department. I see it as a public safety issue. That in the housing and HUD, that person is the homeless person. In your field, that person is the addicted person. That is the person with mental illness. For the Labor Department, that is the unemployed. For the Education Department, that is the undereducated. For the Veterans Department, there are 200,000 veterans in our prisons around the country. So reentry is a public health issue, it's a housing issue, it's an education issue, a substance abuse issue, and a mental health issue. And I would like to turn these slides, but basically these slides are just reiterating what I said to you. It's an issue across many avenues and agendas. So with this as recognition, the Attorney General set out establishing the Reentry Council. And the Reentry Council brings together many federal agencies. The Reentry Council held its first meeting January 5th, 2011, and this is a photo of that. At that table, we had, and this is in the Attorney General's conference room at the Department of Justice, we had 7 cabinet officials and other key administration leaders. It was a remarkable meeting. I had the pleasure of being there. I'm over in the corner, over on this end with the white streak there. And it was amazing to see how engaged everybody was. Normally in a meeting with this high level, people stick to the script that their staff has given them, but that didn't happen here. The secretaries were totally engaged. You could see Secretary Sebelius, someone that you would be particularly interested in, over on the right side of the table. And the council adopted a mission statement. These are all the agencies, by the way. We have now added a 20th agency. At the time we put this slide together, there were 19, but now the Small Business Administration is our 20th agency. So this was the mission statement that we adopted at that meeting. Make communities safer by reducing recidivism and victimization. Assist those returning from prison and jail in becoming productive citizens. And save taxpayer dollars by lowering the direct and collateral costs of incarceration. So these 20 agencies that I mentioned, we have a staff working group. Ken, Linda, and myself are on the staff working group. We meet every month, and the cabinet level meets every 6 months. We're about to have our 3rd meeting tomorrow, actually. So it's and what's amazing is even for this 3rd meeting, we have 6 or 7 secretaries themselves, including Secretary Sebelius, who will be at that meeting. So, how have we organized ourselves so that we make an impact? I've been in government 30 years, Linda's been more, and often we meet, we don't really do anything. We were determined that this time we were going to really make an impact. So we decided to focus our work in 3 specific areas. 1, we are coordinating and leveraging resources that are already committed on reentry in jurisdictions around the country. 2nd, we're focused on removing federal barriers to reentry. And third, we're using, through the secretaries, the bully pulpit to advance the reentry agenda, dispel myths, and maybe some of you have seen our myth busters. If you haven't, you're going to get a chance to get familiar with them. And we're providing visibility to programs and policies that work. So let me very quickly go over the Department of Justice resources. I don't know how many of you are familiar with the Second Chance Act, but within my agency, the Office of Justice Programs, we're responsible for implementing the Second Chance Act. We give grants to state and local governments and nonprofit organizations to develop reentry programs. We've already awarded over $200 million in grants over the last 3 years, and we're about to, we have over 350 active grantees around the country, and we're about to award this year's grants. And the other thing we funded is something called the National Reentry Resource Center, which is run by the Council of State Governments. And this is a very important resource, and at the conclusion of our presentation, we have up here some handouts with all of the websites that will be useful to you, including this Reentry Resource Center. And one thing I want to point out here about what's on that, there's lots of good stuff on there, but one thing on there is this map. And this map pinpoints all of the reentry grants, not only from my agency, the Office of Justice Programs, but also from the Department of Labor and HHS and other agencies. And it's an interactive map, so if you go to the website and you click on the area where you live, you can find out all the reentry grants that are in your area that are helping people coming out of prison and jail with reentry. Let's see, the other important area, okay. I'm going through this quickly because we don't have a lot of time. So one of the key areas and the most interesting to this group and the most important to me is reducing barriers to reentry, because as you know, your clients and the people that we're dealing with come out of prison and jail with so many barriers, having a criminal record, not having work skills, and so forth. And we are focused a lot on this area. Linda's going to go into most of them with you, but I want to focus on just 3 that I think are really important. The first one is, about a year ago, the Attorney General sent a letter to every state Attorney General in the country asking them to review the collateral consequences of criminal convictions in their states. And what this means is many states, all states, have these consequences that even after you're through with prison and you're through with probation and you're through with parole, in the state statutes, you can't get a license for this, you can't get a job for this. As a matter of fact, the American Bar Association, under a grant from our National Institute of Justice, inventoried all of the collateral consequences in every state across the country, the federal government and so forth. They found 38,000 collateral consequences. And the vast majority of them, 85%, had to do with employment. I'm sure you all are aware of this. And so this letter that the Attorney General sent, and the letter is on the website. Everything I'm talking about is on these websites, which you'll get a copy of the URL up here. So asking the state attorney generals to review those in their state and to look at them with the eye towards either removing or narrowing those that don't have a public safety component. For example, if it says you can't do such and such for 10 years, maybe it should say you can only not do it for 3 years. There's no reason to go back that far. So in addition to that, the Attorney General then sent a letter to all of the cabinet secretaries of the Reentry Council members and said, look, if we're asking the states to do this, we should do this ourselves. So we are all looking at our federal collateral consequences, and seeing which ones we can modify to make it easier with people who have been in prison and jail to come out and rejoin society in a productive way. The second thing I want to tell you about is the HUD Secretary, Sean Donovan. As a result of the Reentry Council, the HUD Secretary recently sent a letter, 2 letters, one to every public housing authority in the country and one to every owner and agent of Section 8 housing, saying to them, look, there are only 2 very, very narrow types of former offenders who cannot live in public housing. Those who are lifetime registered sex offenders and those who ran a meth lab on federal property. Other than that, you local housing authorities and Section 8 voucher holders, you have the authority to let people with criminal records into your public housing and your Section 8 programs. And you should do that. And he set out, I don't want to read you from the letter, but he made a really important urging to them to be more open and to consider that people deserve a second chance. And as a result of those letters, we are actually hearing about change. And I'm just going to give you one example because I want to set it out for something you could do. We heard from the U.S. Attorney in Philadelphia who has a reentry program. There was a man that they were trying to help who was sleeping on the church floor, and the caseworker went to him and said, you know, is there anyone else that you could live with? Is there, you know, do you have any family members? Or he said, well, I have a sister, but she lives in public housing, and they won't let me go live with her. So the U.S. Attorney's caseworker took the HUD letter, which you'll have, and went to the Public Housing Authority, and the Public Housing Authority let that gentleman join his sister in the public housing. And we are hearing in Los Angeles, the Public Housing Authority, if you want to move in with a family member, they won't even do a criminal records check. They let you move in with a family member. So we're seeing actual change come from these policy letters. We cannot change we're not ready to change laws. That's too much for us to take on right now in this climate, but we want to do as much as we can with federal policy. And the last one I want to mention before Linda comes on and finishes our part of the presentation is really exciting. And this is brand new, hot off the press. This just happened last week. The Equal Employment Opportunity Commission issued new guidance about how employers can and cannot use arrest and conviction records when making employment decisions. And basically they clarified that employers cannot use, it is illegal for them to use blanket exclusions. They cannot say, if you have a criminal record, don't apply, don't bother apply. They found that this is that the blanket exclusions have a disparate racial impact and therefore violate Title VII of the Civil Rights Act. They issued new guidance clarifying the EEOC policy. In that guidance it says, arrest alone is not proof of conviction, and therefore you cannot use that to bar someone from employment. Secondly, they said, where there's a conviction, you, the employer, have to do an analysis. You have to look at the nature of the crime, how long ago that crime was committed, and the nature of the job, so that there's, in your analysis, a nexus between the applicant and the job itself. This is really, really important. And at the same time that this happened, there was a case that came out because EEOC is also stepping up its enforcement of this law. And this case was against the Pepsi-Cola bottling company. And the EEOC found that they had used arrest records without convictions to blanket discriminate, say basically you need not apply. And in the end, they got several millions of dollars in a settlement, and they got 300 people reinstated for jobs. But what was most important was Pepsi agreed to allow this settlement to be public. Most of the times these settlements are not public, but it is public, and it is also on this website that you will be able to access. And so now we've heard other stories, like where I live in Washington, D.C., we have CSOSA, which is the supervising agency for probationers. And so CSOSA took the Pepsi case to Clyde's. Many of you know Clyde's. They had jobs for all kinds of people, but they had a policy, if you have a criminal conviction, don't bother applying. So they took this decision to Clyde's, said, look, what you're doing is illegal. We don't want to, file a suit here. Clyde's changed their policy. So these are the kinds of things we're particularly proud of, the anecdotes that we hear, and the fact that what we're doing is actually making a difference in people's lives. And Linda is going to talk a little bit more about our other initiatives in this access to benefits and doing away with barriers.
All right, I gotta get the slides caught up here. All right. Well, I'm Linda Mellgren, and I'm really glad to be here. And I know that most of you are probably aware why we're talking about reentry stuff to a behavioral health addictions kind of conference. But I want to talk a little bit about that from my own experience because I came to this reentry work not through the criminal justice door like Maureen talked about, but I came to this work through a different door, and that was I was working on the administration's fatherhood initiative during the Clinton administration, and we were worried about low-income men who weren't paying their child support, unmarried fathers, and we looked around at the research, and what we found was that a very, very high percentage of the fathers that we were concerned about as a part of that initiative had criminal justice records. And we realized that, that a lot of the things that we're doing, yes, could make a difference, but unless we dealt with that criminal justice piece, we weren't going to have the kind of success we wanted around the fatherhood initiative. And I think the same is true on the world of behavioral health. If you scratch the surface, a high proportion of the population that you're working with and serving has probably had criminal justice involvement at some point in time. And a lot of the work that the Reentry Council is trying to do is sort of say, look, we've got to be looking at all of these folks in a much more holistic kind of way, and we've got to be addressing all of the problems. And Maureen sort of gave the litany that we have at the beginning about how this is a public health issue and this is a housing issue. And that is so critical, because if we're not dealing with all of the issues, then we're probably not going to have the success that we could otherwise have. So one of the things that the Reentry Council decided was that we have to have a mechanism for clarifying the various policy, both changes, but policy clarifications that we're trying to make. So how many of you have either heard or have used the following phrase, we can't do that because the federal government won't let us do it? I don't know, I want to see a show of hands. I want to see an honest show of hands. The federal government won't let me do it. The reality we found out was that that statement was being used in an awful lot of cases when it wasn't really true that the federal government would let you do it. It was really that it was state policy or local practice, or in some cases it was a matter that in one state you could do it, in another state you could, and people were all confused about what the rules were because there was a lot of more flexibility in the federal government than people want to give us credit for. So, after that long-winded explanation, I want to talk about the mechanism that we have put in place to try to clarify some of those policies. And that mechanism is the Mythbusters. And the Mythbusters are a product of the Federal Reentry Council, and they are designed to clarify existing federal policies that affect the formerly incarcerated population and their families. Each of the Mythbusters sort of lists the myth, that describes in detail, sort of different state policies. It lists suggestions and recommendations for readers, and then it usually has sort of an online reference. And I'm going to spend a little bit of time talking about these Mythbusters, the topics that are covered, and then I'm going to spend a little bit additional time talking about one of the other projects that we have underway to try to improve the lines of communication around federal policies. So as you can see here, this is just an example of the areas that we're dealing with: child support, SNAP benefits, criminal records, Medicaid eligibility, the areas that Maureen talked about, the housing and the employment ones, have also been turned into Mythbusters. So we've got a whole variety of these particular Mythbusters in place. So one of the things that have been often stated, especially by people who are coming out of prison and other people, is that once you have a criminal record, you can't find a job. Now, it's true, it's hard to find a job, and in this economy, it's even harder to find a job. But the reality is that there is no bar from employment because of a criminal record. And so what we have to do is make sure that people understand, what the constraints really are. Another Mythbuster we did was on criminal record histories from companies, sort of how, in fact, they can get them, and the fact that they can't get that information without your permission, so that you have to know that. We've got a Mythbuster on child support. There's a, sort of a misunderstanding that child support cannot be reduced when someone's been incarcerated. There are bars to that reduction, it is true, but by working with the child supporting programs in many states, but not all, there are ways that child support can be dealt with for those who are coming out of prison and jail. Same is true with the termination of parental rights. There's a pretty high bar in this particular area about the termination of parental rights when somebody is going to be in prison for a long period of time, somewhere over around 22 months. But the reality is that states have the flexibility to use exclusions that are written into the law to make sure that parents' parental rights are not terminated when it's not appropriate to do so. Many people don't understand that. Many child welfare workers don't understand that. And the people working with folks that have incarceration histories and have addiction and mental illness as a part of it don't understand that they can, in fact, work with their child welfare agencies to find ways not to terminate parental rights. So I'm going to talk now about a couple of the other Mythbusters that relate to access to benefits. And one of the things that happens when somebody comes out of prison or jail is that they need access to income. They need some way of taking care of themselves. And there are some exclusions relating to the access of public benefits for people who've been incarcerated, but the bar is not nearly as high as often is talked about in those sort of casual conversations. So we've made some administrative policy changes in the area. We've got 10 benefits-related Mythbusters, and we have a benefits action plan which has developed a points of contact matrix, which is the last thing I'm going to talk about at the end of this presentation. So what are some of the benefit access Mythbusters? One of them has to do with access to Medicaid. Now this is a clarification that's been around for a long time, since 2004, in fact, when there was a state Medicaid director's letter that went out. But the reality is that if somebody goes into prison or jail and are currently Medicaid eligible, they do not have to be terminated. The prison or jail cannot get reimbursed for their Medicaid expenses, but they can be put in suspension status rather than terminated, so that when they're released, they can very quickly receive their Medicaid benefits again. So we are encouraging states to think about sort of changing the processes that they do to make sure that Medicaid is not terminated when suspension would be a more appropriate option. Another myth has to do with whether or not a parent with a felony conviction can ever receive TANF or welfare. I mean, we've heard people talking about, you know, oh, can't get welfare, and the next Mythbuster is on SNAP benefits, food stamp benefits, can't get food stamp benefits. The reality is that those provisions only apply to folks who have had drug offenses. Now that's important for this audience. But more than that, most of the states have in fact changed their requirements so that folks can in fact get SNAP or TANF benefits even though they've had a drug conviction. I think there's 11 states for TANF, there may be 12 states for food stamps. The Mythbusters, you know, reference material where the actual states can be identified and what their policies are, but many of them allow for resumption of benefits if somebody has gone through a treatment program. Or is in keeping with all of their parole requirements. So it really isn't a yes or no kind of issue. There's a lot of discretion to the states, and states have different policies, so it's really important to know what your state policy is rather than to just presume that for the people you're working with in your state, there would be a ban to food stamps or TANF. One of the other areas that there's been some misunderstanding is whether or not you can begin the process to apply for Social Security benefits, SSI or disability benefits, or even retirement benefits, you know, before someone is released from incarceration. And the answer is very definitely yes. That there is a process where those benefits can be applied for while someone is still incarcerated so that they can be resumed as closely upon release as possible. And there are memorandums of understanding being developed between local SSA offices and correctional institutions to make sure that that happens, and there's, you know, special programs that are being put in place, like the SOAR program, which even sometimes has special individuals to help make sure that the application process moves for those people who might not be able to do it on their own. Another area where we've made some where we've made some, where we've done some Mythbusters has to do with veterans benefits. And that is also very important to a population which may have addiction or mental health issues. One of the myths that was out there was that veterans could not request to have their VA benefits resumed until they were released from incarceration. Again, like with the Social Security benefits, you know, there is the possibility of working with folks before they're released so that benefits can be put in place as soon as possible after release. And another clarification that we made was that incarceration itself is not a bar to getting help from the VA relating to health care if they are otherwise eligible. That is, if their discharge was
not a dishonorable discharge, they are probably eligible to receive VA health care, and the fact that they were incarcerated is not a factor in determining eligibility. So one of the other issues, one of the other things that we've been doing is developing a federal contacts network. What this map shows is how across the country the different federal agencies are really divided into different regions. You know, for HHS, if you're in one of the regions, and I used to work in Region 5, Chicago, and I wanted to talk to my friends at SAMHSA or my friends at CMS or folks in Social Security even, because Social Security was part of HHS when I worked for them, we could easily find out who those other federal contacts are. But what we've found is that as we look at reentry in a very broad perspective, it's really difficult to find out who the HUD counterpart would be, and the Federal Bureau of Prisons, and the Social Security, and the Veterans Benefit, and the labor counterparts, because all of the regions are set up differently, and they have different hub cities, and they have different states that they cover. And if you look closely at this map, you will find that, in particular, I don't know if anybody is here from New Jersey, but New Jersey is sometimes in the region that includes New York, and then sometimes in a region that includes Pennsylvania, and so, you know, and so what you often have is a difficulty of sort of trying to figure out how you find the appropriate federal people who can sort of navigate the systems, not necessarily for individual casework, but to try to develop some kind of a systemic response. How are we going to treat cases that look like X, Y, or Z? And so we have been spending the last few months developing what could essentially be called a directory of federal contact people who are listed on a state-by-state basis, include the state reentry coordinators as well, so that as communities try to look at their reentry strategies and their reentry policies, they have a much easier time finding who are the counterparts across all these myriad of federal programs that need to be involved in reentry strategies. And that document has just gone live in the last week. So it's going to be a really important tool, and right now we'll be thinking about how we get not necessarily access to the directory itself, but information out as to who the contact people are to a broader community of folks such as yourself. I just want to sort of wrap up a little bit about sort of our thinkings about sort of the Reentry Council and its importance. And that is, we're really at a point where there are tremendous opportunities. There is bipartisan interest and support around reentry issues at the federal, state, and local levels. Red states, blue states, purple states, everyone is concerned about the money they're spending on corrections and trying to think about how they can do things better. They want to protect public safety, but they also don't want their correction budgets to keep going up and up and up. So that credit crunch, that fiscal crunch, is really creating an environment of interest across the spectrum of governments. At the federal level, the Reentry Council is sort of taking advantage of that by meeting on a regular basis, and as Maureen said, the Reentry Working Group is meeting, on a monthly basis to see what are the changes and additions that we can do to improve federal policy. And we're optimistic that we can make a difference. And just sort of lastly, we have up here some pages that have reentry links, URLs, that you can go to get more information about what's going on, and we hope that you do so. And now I'm going to turn this over to Ken Robertson.
Good afternoon. Okay, it's really tough in an hour to have a three-person panel and then save 15 minutes for Q&A. So I'm from Maryland. I love horse racing. If you saw the Kentucky Derby last week, it was 2 minutes. This is going to be fast, folks. So I have a lot of slides that you will not see, but I've been told that all of these will be posted. I try to do that so you have other factoids that you're not going to get here. But I want to say a few things very quickly. Behavioral health and the prevention and treatment of behavioral health issues is important to the federal government. Last year, to quote our president, substance abuse and its consequences have grave impacts on our society, destroying lives, tearing apart families, and introducing drug-related violence to our neighborhoods. You deal with that in your work with these populations and the effect on your communities. I like to think what Kathleen Sebelius, our Secretary of HHS, said reflects what you do. Mental health and addiction professionals can serve as what are called recovery navigators, helping to connect patients with health screening as well as counseling, medication management, housing, and job training. And that's what I think you are. You're recovery navigators, and in particular for the population we're talking about, individuals that are involved in the criminal justice system who have behavioral health issues, be it substance abuse or mental health. SAMHSA is the federal agency that's responsible for improving our nation's prevention and treatment of behavioral health issues. We're actively involved in the Attorney General's Reentry Council, and our specific focus is on behavioral health issues, which is what I'm going to talk about today. Again, some of these things you know, but just the magnitude of the issue when it comes to offender reentry, criminal justice, and behavioral health. We have about 2.2 million people incarcerated in jails and prisons, although we're beginning to see signs of leveling and decrease at the state level, primarily due to economic reasons. States are having to shut down prisons, quite frankly, and develop alternatives. But this is still the highest incarceration rate in the world, and 1 in 100 American adults is incarcerated, and 1 in 24 African American male adults are incarcerated in certain communities. So it is a huge issue for us. The issue of corrections and public health risk is also important. As you know, I pointed 2.2 million people, 9 million people cycle through jails and prisons each year. Unless you die in jail or prison, you come back out into the community. And we have really high numbers of public health risk with STDs, HIV, hepatitis, communicable diseases. A quarter of the people living with HIV have spent time in a correctional facility. The prevalence rate of confirmed AIDS cases in facilities is more than 2.5 times that the rate of the general population. So this is a critical issue for us. Interesting study shows that for African American males, they actually have better health care in the correctional system. But when they return to the community, their levels of mortality, illness, and injury are astronomically high in the first 3 weeks of their return because the services are not there in the community. The intersection of criminal justice and behavioral health, we saw an explosion of incarceration. I mean, I tracked this stuff myself, and I really didn't realize the figures were this high, but from 1982 to 2007, the jail and prison population nearly quadrupled in the United States. And 1 in 5 of those individuals has a diagnosable serious mental illness, and many of those have co-occurring disorders of substance abuse and alcohol. The most common reason for incarceration in jails is substance abuse-related crimes. Almost 15% of males and 31% of females that are in correctional facilities admitted to jail have a serious mental health disorder. And as was mentioned early on, about 740,000 individuals returned from these correctional facilities, state and federal prisons on a regular basis in the U.S. So as you're aware of, as you look at these additional statistics, you see the correlation between behavioral health needs and issues and the criminal justice system. That makes targeting this population a primary and critical one for targeting our resources at the federal, state, and local level in order to assist the individual, the community, and the nation. There's also a drugs and crime connection that goes back 40 years. I won't talk about that. You know that. It's been established in research repeatedly. There's something interesting here in this slide. This slide is referrals to publicly funded substance abuse treatment programs in the United States. The red part of the slide, which makes up about 38% of referrals, are referrals from the criminal justice system, and of that 38%, about 45% are from probation, parole, and prison. So what we're saying is that more than self-referral, more than family referral, people coming from the criminal justice system are referred into our criminal justice, coming from the criminal justice system are referred into our publicly funded substance abuse system. And again, that makes this population really critical in dealing with their needs. In terms of those individuals, one of the really interesting things is that people, though, who have been referred to treatment from the criminal justice system, what I call voluntary coercion, if you're in the system and you want behavioral health, is stand a very good chance of completing treatment or transferring to further treatment. In fact, we have 50 years of research that indicates that compulsory treatment through the criminal justice system is at least as effective as voluntary treatment, if not more, in the community. I want to spend just a second talking about something that's just now really coming into vogue, although you've been dealing with it, I'm sure, for years, and that's the reported prevalence of trauma in behavioral health. The majority of adults and children in inpatient psychiatric the majority of adults and children in inpatient psychiatric and substance abuse disorder treatment settings have trauma histories. 43 to 80% of individuals in psychiatric hospitals have experienced physical or sexual abuse. 2/3 of adults in substance abuse treatment report child abuse and neglect cases. So this is an important consideration when we're dealing with individuals with behavioral health issues, and it's certainly reflected in the population that's returning from prison. So what are we doing about this? Some of the SAMHSA responses are 4 key principles, and I'd like to add for those involved in the criminal justice system after each one of these statements. Behavioral health is essential to health for those involved in the criminal justice system. Prevention works for those involved in the criminal justice system. As we all know, this is an intergenerational issue. It doesn't just start and end with the male or the female that we're dealing with. We're dealing with a family constellation that's at much higher risk for addiction, for mental health disorders, and for criminality. Treatment is effective for those individuals who are involved in the criminal justice system. And people recover from mental and substance abuse disorders for those involved in the criminal justice system. SAMHSA has grant programs that total over $2 billion, about $1.4 billion that is in our block grants, which you should be familiar with. They go directly to the states and then contracts on down to the providers. But we have about $800 million in discretionary grant funds. I head up a team that, as was said during the introduction, has $67 million in grant funds to expand or enhance substance abuse treatment for those involved in the criminal justice system who have either co-occurring disorders or have been diagnosed with substance abuse disorders. We have about 180 discretionary criminal justice grants, and we'll be funding 85 new ones this year. I wish I had time to talk about the subway map. I don't, but think of the criminal justice system and all of its impact points as a subway map. People come in, people get off. That happens throughout the criminal justice system. And for behavioral health professionals, every one of those stops is an opportunity to intervene with those individuals. Today we just happen to be talking about the back end of the system, for those who are returning to our communities. But from the time of arrest all the way through, each of these are opportune times for screening, for assessment, for various interventions. And that's a great way to think of this. Next, we'll be working on an intergenerational, three-dimensional approach to this. It's not quite so linear. So, I was going to spend time talking about our new offender reentry program. Unfortunately, it closed last Thursday. So I will jump over these slides and just tell you for a second about that program, because we've been funding this on an annual basis. It was $12 million for, $5 million for up to 12 awards, $400,000 a year for a 3-year period, an open solicitation, meaning state governments, local units of government, community-based treatment providers could have applied. The intent was to create a continuum that links the institution, in terms of institutional corrections, with community providers, to build infrastructure, to create systems change, and to provide services for those individuals with substance use disorders and co-occurring disorders. As I said, I regret it closed May 1, but you might want to go to the SAMHSA website and take a look at that program if it's something that you might be interested in down the road. Very quickly, just want to run down a couple of other topics in terms of addressing the challenges that I presented. One is integrating behavioral health in order to fully serve an increasing number of individuals that are in the system with co-occurring disorders. How many of you deal specifically with individuals who are in some part of the criminal justice system? Okay, most of you. How many of you are dealing with someone who's presenting primarily with a substance abuse disorder, alcohol or drugs? Now, those who have your hands up, keep your hands up if the majority of those individuals you're dealing with also have a co-occurring mental health disorder. Yes. The system is slow to deal with this, to fund this, and to recognize this, but it's critical. At SAMHSA, we're dedicated to integrating behavioral health in such a way that substance abuse and mental health are together. One of the things we did last year is we funded a program called Adult Treatment Court Collaboratives that integrated our treatment services dollars, like I just talked about in the offender reentry program, with our Center for Mental Health Services systems transformation dollars, so that anyone coming into these court systems who had a mental health diagnosis, a substance abuse diagnosis, or a co-occurring diagnosis could be funded out of the same grant funds. And that's very unusual because of the way the funds, as you know, are bifurcated. So we're going to attempt to do that on the offender reentry side as well. The following is a list of topics that, again, we don't have time today. The Derby's almost over. Unfortunately, Bogey Meister's beginning to fail a little bit. No, I've got actually 2 or 3. But again, with the ACA, expanded health coverage for individuals in the justice system. Mady Chalk just talked about that coming change. Health information, technology, and electronic health records. That's something all of you should be aware of. She talked about in terms of third-party payment. Changing Medicaid benefits eligibility, Linda just talked about. Training on trauma and trauma-informed care, screening assessment for co-occurring disorders, rapid HIV testing. Those are all the kinds of things that need to be built into services when you're dealing with this population. And I'll actually close with these 2 slides. I have a few more, but I want to close with these 2 that I think are really important. I mentioned the prevalence of trauma and the justice-involved individual, and the need to address this through education about and adoption of trauma-informed care practices and trauma-informed systems of care. We have a new technical assistance center for trauma-related issues, and one of the goals for the next year is to standardize all of these various definitions of what constitutes good trauma-informed care and trauma-informed systems. And I want to refer you to the SAMHSA website, which, by the way, is www.samhsa.gov. I want to leave you with this comment. It's a quote from an ex-offender who I think says it all when it comes to trauma-informed care. During every incarceration, every institutionalization, every court-ordered drug treatment program, it was always the same. I was always treated like a hopeless case. All people could see was the way I looked or the way I smelled. It wasn't until I finally entered a recovery-oriented, trauma-informed treatment program a little more than 4 years ago, where I felt safe and respected, that I could begin to heal. Someone finally asked me, what happened to you, instead of what's wrong with you? Thank you very much.
Okay, I wanted to make sure we had time for some questions, so please. I rushed my panelists. Okay, real loud.
That's okay, I can do that.
You can, I can hear that.
Mine is more of a comment and actually curiosity. You talked about public housing as a barrier for many folks re-entering. I'm a provider of both mental health and substance use services and a housing provider. We also help people try and move into housing in their communities. And we're seeing a growing trend of people who have felony backgrounds being excluded from rental apartments, rental complexes, and being done not in a local way. These are national organizations that own these complexes, real estate trusts that own them, and we see it as a growing challenge, particularly with the economic barriers that are driving more and more people into rentals. So there's more strategic ways that many of the folks we serve are being excluded from not public housing, but private housing. So I'd love to hear from you guys what's being discussed on a national level.
Basically, the question has to do with the exclusion of people with criminal records from private housing. You know, I don't know the answer to that, but it seems to me that there's local legal services in your communities might want to help people. If you can't discriminate against jobs on an interpretation of Title VII because there's a disparate impact based on race, if you discriminate against a population with a former criminal record, that same thing might apply in the housing area. I don't know that for sure, but it seems to me that you would want to go to the local legal services and see if you can get somebody to look at that issue for you.
We have, and there's limited case law at this time to support it, but this is becoming a huge issue with the economics of people not able to own their own housing, and more people who own housing moving into this market space.
Right.
So
who is there's a, if you give me your card, there's a couple of public interest groups that really specialize in the housing area, and I'll see if I can hook you up with them. They may not have resources. Anyone else with a question? Well, I guess you get a longer break. Thank you very much.